Hi guys, my name is Karen Dees. I'm the Marketing Manager for Patient Concierge Services. And for those of you that don't know who we are, we provide a full wraparound service for anybody wanting to visit Bali for cosmetic or plastic surgery, from booking your appointment and providing care and concierge packages. And part of our service is getting to know the choice of procedures, treatments, doctors and plastic surgeons available. And today we have the honour of chatting with Dr. Theresia.
Hello, Karen. Hello, I'm Dr. Theresia, the dermatologist in BIMC Nusa Dua.
Beautiful. How long have you worked here?
I'm almost a year here.
1 year?
Yeah.
Wow. And what kind of things do you do?
So generally, I do everything dermatologists do here, especially for like skin disease, skin conditions, also aesthetic procedure.
Okay. So you're very talented.
Thank you.
Yeah.
I take it as a
I have heard great things about you, actually. Yeah, I have. And I think, you know, referencing back to you working here at BIMC, you obviously also work very closely with the plastic surgeons here as well. And the most popular procedure is the facelift. So most of our clientele are over the age of 50 and they want to rejuvenate and refresh their face. So obviously you're a very skilled and talented doctor, being a dermatologist, and there's lots of things that you could do, even if it's related to health or aesthetics. I think a really good starting place for us would be to talk about CO2 laser, as it's becoming more and more popular. So first of all, what are the benefits to CO2 laser?
So basically, CO2 laser is an ablative laser.
What does ablative mean? I'm asking because I know that this is what people watching the video are going to say.
Burn your epidermis, the top of the layer of the skin.
Okay.
So it can help your skin to promote the new skin production. So that's why it's like you have the new skin growth.
So it's new skin growth. Does it boost collagen?
Yes, of course. So in the CO2 laser, we create the new wound on the skin, which we hope that after that wound, our skin will produce the new skin, produce new collagen. So in the future, your skin looks smoother, more radiance, and also the fine lines, fine wrinkles you have reduced after the CO2 laser. Okay,
beautiful. Who would be a good candidate?
Okay, so of course the people who has like fine wrinkles, even like scars.
Okay, it's good for scars.
Yeah. Also, people with mild skin laxity, usually when people do some surgery or kind of like eyelid surgery with fine or mild skin laxity, we can help with the CO2 laser.
Oh, mild skin laxity. That just really stuck out in my mind, because the laxity in the skin, it's like, how do you define if it's mild, medium or severe, I guess?
Yeah.
It's like depends on their age and their lifestyle.
That's right. Depends on the age, depends on the lifestyle. Sometimes people hesitate to do surgery. They're afraid of the surgery. So for the mild or light one, they can do the laser CO2.
So would I be right in saying it's like controlled trauma?
Yes.
Yes. Controlled trauma to the skin. So if somebody has it done, what would they look like, I say, the next day?
Okay. So usually people who do CO2 laser usually experience redness.
Yeah.
Some people have swelling, like you have an allergic reaction for the 1 or 2 days. And then also your skin will be dry and you might feel warmth or even burning sensation.
Okay.
But after 1 to 2 weeks, your skin will be peeling off.
Okay.
And after that, your skin will look completely new.
So it's like removing the current layer of skin and allowing the new one to come through.
That's right.
Beautiful. I'd really love to talk a little bit more about the CO2 laser. Thought you'd explained it really well, but as you know, we provide service for ladies and men having plastic surgery, and the most popular procedure is the facelift, deep plane face and neck lift. And there's been some discussion around whether they should or should not combine having the CO2 laser either at the same time or afterwards. Do you know much about this, like combining it with the surgery choice?
Okay, so actually the CO2 laser can be combined with the surgery and help to give the better results also. And when we do the CO2 laser, it really depends on the patient's condition and also surgeon's preference. But it's doable to do the CO2 laser during the surgery.
Okay.
On the same time.
Right, okay, that's really interesting. Thank you for explaining that. So my understanding is it's not an automatic yes. It depends on the patient's condition.
Yeah.
Obviously, what their health is like. If they suffer with high blood pressure, that might be a barrier to having it done at the same time. And also the surgeon, sometimes they say yes, and sometimes they would prefer to have like a gap after the surgery.
Yeah, that's right.
Do you know what the benefits might be for, say, somebody who's fit and well and healthy, to have it combined with the surgery?
So basically, if the patient is a good candidate to do the CO2 laser on the same time during the surgery, actually it's more beneficial for the patient because the surgery will be done under general anesthesia. So if the doctors allows the patient to do the CO2 laser right after the surgery, for the patient it will be, of course, painless.
Yeah, because they're asleep.
Yeah, that's right. And also the downtime will be similar with the surgery, so you don't need another downtime after several weeks after surgery, right?
I see. So it's combining the downtime.
That's right.
So if you got the CO2 laser in isolation, like not linked to surgery, the downtime is still like 2 to 3 weeks.
Yeah.
But then if you have it with the surgery, it's still 2 to 3 weeks for facelift surgery, so it's the same. Yeah. Would there be any risks with that, do you think?
Yes, of course, we cannot completely avoid the risk, but if you do the CO2 laser during the surgery, the reaction after the CO2 laser would be more prominent than if you do it separately. Yeah, you have more inflammation, more swelling, but of course, it backs to the downtime.
Yeah.
We have it on the same.
Yeah, we've had hundreds of patients that we've looked after through the surgeons at BIMC, and they're all thrilled with the results. And some of them do combine the CO2 laser, and it's really good for us to learn at Patient Concierge Services how we look after these patients, because they're quite emotional anyway. It's quite emotional having plastic surgery, and we've noticed for the first few days, they can be unrecognizable, and it can be quite a shock looking in the mirror.
Yeah.
But honestly, like 7 days later, they're like a new woman. Like you really see the results starting to like blossom like a flower opening. So I think if they're fit and well and healthy, if the surgeon says yes, if you're brave enough, because I don't think it's for the faint-hearted. I think you have to be pretty brave and maybe have a high pain tolerance.
That's right.
Then it would be worth considering doing it at the same time.
Together.
At the same time.
Because the result also more.
Yeah. So regardless whether somebody has the CO2 laser after surgery or whether they do it, separate, what kind of aftercare should they be considering?
Okay, so for the aftercare, generally it will be the same without or with surgery. So after CO2 laser, you are recommended to avoid direct sunlight, of course, for the first week. And then also to put skin barrier moisturizer to keep your skin barrier health and good. And of course, in the morning, you need to use the sunscreen, SPF, and you can reapply if you go outside. And also for the other skincare, especially the active ingredients like alpha-hydroxy acid, salicylic acid, retinol, or any tretinoid acid, you need to stop at least until the recovery complete. So usually after the surgery, the surgeon or the doctor also will limit the use of the active skincare ingredients.
And you just taught me something there. I didn't realize that's what it was called. Active skincare ingredients.
Yes.
So that could possibly create extra irritation if they use it.
Yeah, that's right.
And what would you what would be considered a skin barrier cream? Is that like an LEC balm or Vaseline or?
So you can choose any kind of moisturizer, especially for the skin barrier. It's like the moisturizer that contains like hyaluronic acid, ceramide, pseudoceramide, or cica.
So they're skin barrier creams?
Yeah.
Okay. If you'll allow me to just talk about myself for one moment. I had a similar treatment to CO2 about 2 weeks ago. It was called erbium. Do you know what the difference is between erbium and CO2?
Yeah, actually it's quite similar procedure, but CO2 laser is quite more stronger.
It's stronger
than erbium.
So if you had more fine lines, CO2 might be a better solution.
Yeah, but it comes back to patients and skin conditions.
Yeah.
You know, we need to assess like what the patient's skin type, how about the healing tendency.
Yeah.
Sometimes people see the other's result good, but it cannot be similar with yours.
Yeah, okay. So if someone's trying to decide for themselves, should it be CO2 or should it be erbium? Because I think there's ablative and non-ablative. Is that right?
Yeah, that's right.
So really, they shouldn't be making the decision themselves. They should have a consultation and let the doctor decide for them.
That's right. That's the best to do.
Yes. So if you're watching, ask a doctor and then find out which is the best one for you. Just a quick one on the aftercare. If someone's really struggling, like if they're just like, oh my God, I feel like it's the worst sunburn I've ever had in my life, how could we make them more comfortable?
Okay, so as I said before, after the CO2 laser, you really need to keep your skin barrier health. So after the CO2 laser, I usually recommend my patients to keep washing the face using the gentle cleanser, not with the active ingredients, and then always put the barrier skin cream or lotion, and also to use SPF. And usually after the skin peeling finish, you can start to use your normal skincare.
Okay, is there like a cooling gel or anything they could put on?
Right after the CO2 laser, we usually do the cold compress for the patient.
Cold compress?
Yeah, cold compress.
Okay, so it's okay to use ice or a cold compress?
Usually like the ghost and...
Oh, okay, just like cooler. Is that better to only do for the first 48 hours or first day?
Yeah, usually the best to do is in 48 hours.
Okay.
Because sometimes in some people, they also have swelling after CO2 laser. It also helps for that.
Okay, cool. And then stop after that?
Yeah, stop after that.
And just let your body do its natural thing?
That's right, with the skincare.
Yeah. Could they take anything like paracetamol, antihistamine, anti-inflammatory tablets?
Okay, so for some people, especially for the people who has low pain tolerance, we can give them like painkillers just to make them more comfortable.
A little bit more comfortable. Okay. And do you use numbing cream?
Of course.
Yeah.
If we don't do under general anesthesia, of course we do under numbing cream.
The numbing cream. Okay, beautiful. And how many times per year should somebody do this?
So because it's really related to the downtime, I recommend more to do it at least 2 to 3 times a year.
Wow.
Not every month, because you need to struggling with the downtime.
Oh my God, I thought it was like once a year. I didn't realize it could be up to 3 times a year. Depends on the patient. So it's a case-by-case scenario.
Because it's also related to the person's habits, like
lifestyle,
UV, exposure habits.
If they're like, maybe if they work outside, they might need a little bit more.
Like we're in Bali with the very bright sunlight, we cannot do it like too often in a year.
Just one last question on that. Is there a skin type you do not recommend this for?
Basically, the skin types that recommended to do the CO2 laser, especially the ablative or the aggressive one, is less than skin type 3.
What's skin type 3?
So skin type 3, like us, the Indonesian people, who the skin more easily to get tan than to get burned.
Oh, okay. So if you tan easily?
That's right.
Okay.
So for the skin type 3 or more, if we do aggressive treatment, even not CO2 laser like the other, microneedling or anything, with the aggressive treatment, our skin type has a higher tendency to get hyperpigmentation or even scarring. Okay.
It's really popular for people to have Botox, fillers, and there's loads of other beautiful things like collagen stimulators. I think another one is called salmon DNA. And there's another thing that escapes me. I think is it like some type of cell booster. And it's so confusing. Please help us make it less confusing. Like, what should somebody do? You know, what is not to do? Like, or is it just a case-by-case scenario?
Related to the facial surgery, we can do injectables because sometimes...
like in the lead up to surgery?
So for the Botox itself, surgeon usually prefers to do the Botox more than 6 months before the surgery.
Okay, why is that?
Because for the surgeon, they really need to assess the patient's most natural state of the face.
The most natural state of the face. That's a really, really good phrase.
Especially if we do like facelift.
Yeah. So if somebody has had quite a lot of fillers and then they want to have a facelift, what would the advice be to them?
It really depends on the doctor's preference, but some doctors might be asking the patient to dissolve the fillers because sometimes many fillers, especially for the area that the surgeon will do the surgery, it can affect during the surgery. It can make the surgeon difficult to dissect the tissue. It's preferable to avoid any dermal fillers or maybe thread lift.
I was going to say, I think thread lift's a bit longer, maybe like 9 months, is it?
Yeah, that's right.
Does thread lifts create scar tissue?
Basically, yes, because when we do the thread lift, it's like promote your skin scar tissue to lifting your skin from the inside.
Okay, I have a million questions, but I know we don't have enough time. Let's talk about people who aren't having surgery and they love Botox and fillers. Because there's like new fashion now, I've noticed. Like some people are dissolving filler and getting less. And then I've also noticed that some people are getting a lot of filler in their chin.
Yes.
Is this like a new thing?
Not really.
No?
But yeah, people do that nowadays.
What are the benefits of that?
So it really depends on the people expectation and preference. Like nowadays, especially in Indonesia, the beauty preference like Korean beauty, K-pop. That's right. So ladies expect their face become more V-shaped. So it's like Botox on the jawline. They need longer facial, so they need chin filler.
I've noticed some people even getting their lip fillers dissolved lately, like and even going a little bit smaller. Have you noticed a trend in fillers being dissolved or?
Yeah, it really depends on the patient expectation and beauty preference because some people want like Russian lip fillers.
Russian lip fillers. Oh my God, there's so many techniques these days, isn't there?
Yeah, so many techniques. And in my opinion, the lip filler is like signature. Really depends on the people preference, like Asian preference or Russian preference. It will be so much difference.
And from your personal experience, if somebody comes to you and they have a lot of filler on their lips and they want more, do you say no or yes? How do you manage that? Because I've heard there's such thing as called filler blindness. Have you heard of this? Where they look in the mirror, they can't see the filler anymore, they're blind to it. And they think they need more.
That's right. To be honest, my preference is more natural. More defined. That's right. I sometimes encourage my patient to love their natural more. I mean, not every surgery or aesthetic procedure should make you a different person, but the better version of you.
An enhancement. Patient concierge services, as I mentioned earlier, we've looked after hundreds of people coming to Bali for face surgery, breast surgery, body surgery, but still the most popular procedure is the deep plane face and neck lift. And there's a lot of questions around what should they do in the lead up to surgery and what should they do post surgery. So as a skin expert, as a dermatologist, help me answer that question.
Okay. From my dermatologist point of view, prior to the surgery, it's really important to keep your skin health, especially skin barrier. Why? Because in the surgery, we need our skin to heal properly to give the best result. So I highly recommend our patient to prepare the skin prior the surgery. Especially for skin quality, you can use the proper skincare to keep the skin barrier, to keep the skin surface, skin quality.
How do you prepare the skin?
It really depends on the skin problem, but generally we need to moist our skin because the better moisturizer of our skin, the more hydrated our skin, the better healing we can achieve.
From the surgery? So moisturizer, hydrated skin is key. I know a lot of our ladies sometimes struggle, but giving up smoking.
Of course, smoking and drinks.
Smoking and alcohol.
Yeah.
Okay, so to stop that in the lead up to surgery, hydrating your skin, sleeping well.
Sometimes I also recommend our patients to prepare the skin from the inside and outside. Not
Oh, I
only
love this. Tell me more.
Yeah, like maybe multivitamin or antioxidant. Even like usually 1 week before the surgery, I usually recommend our patients to stop some of them, like active ingredients in the skincare, like alpha hydroxy acid, retinol, tretinoin, or like supplementation, especially like omega-3, omega-6, antioxidant. It's good for the skin healing in the future, but right before the surgery, at least 1 week before, we need to stop because it can affect the bleeding during the surgery.
Yeah, I've heard this before, is omega-3, vitamin E, even vitamin C I've heard.
Yes.
Which was a shock to me. I was like, I love vitamin C, but it can all be like a blood thinner, is that right?
Yeah, because basically they work to help our skin healing, make our skin promote the new collagen, promote the new vascular under our skin, so that's why we need to stop it right before surgery.
About a week before.
One week before.
And you said a word earlier, you said antioxidant.
Yes.
What's that?
Antioxidant, usually from oral.
Okay.
Can be also from the topical, also, and the cream, in the serum.
How'd you get an antioxidant cream?
Some brands now has the mixture of the hyaluronic acid with antioxidant or with even vitamin C is antioxidant.
Oh, really?
Yeah.
Interesting. So you can maybe accelerate that up until a week before and then stop.
Yeah, stop.
Okay. But the key thing is hydration.
That's right.
Through moisturizers and water as well.
Yeah. Hydrate.
Okay. You also mentioned earlier stopping Botox, fillers, threads, ideally 6 to 9 months before, so the surgeon has the face in the most natural state.
Most natural state.
I think that's what you said. Love that. I'm definitely going to steal that. And what about post-surgery? It's like, how do they protect their investment?
Okay, so right after surgery, of course, the patient will get some prescription from the surgeon, like healing cream, antibiotic orally or topically. But after surgery, it's highly recommended for you to keep your skin moist, so you can use gentle cleanser, moisturizer, and of course sunscreen. Maybe in some kind of surgery, it will be different for the timing for the skincare, but generally that's like that.
So that would be like the initial first 2 weeks though. So what happens when they get back to their resident country, which is predominantly Australia, where, you know, they also have a lot of sunshine there most of the time? How do they protect their skin for the next 6 to 12 months?
Yeah. So usually I limited my patient from their active ingredients at least the first month. After a month, they can back to their routine skincare, especially with the active ingredients. Because for the active ingredients, we really need to wait for the skin completely healed.
Okay. Because I know it's really popular here for ladies to buy, I think it's called Vitacid, which is like retinol in concentrate form.
Yeah.
Because it's like $4 here and it's like $60 in Australia.
You heard about it?
I have some at home. So that's considered an active ingredient.
Yeah.
So it's it could be an irritation.
Yeah, basically that's the retinol, retinoic acid, derivative of vitamin A, which is, it helps your skin to grow more collagen, to make your skin tighten the pores. Even in the acne skin, it helps to reduce the acne. So it's really beneficial for the skin. But related to the surgery, of course, we need to stop at least 1 week before, and we can restart again the use of the retinol, usually a month after.
A month after. That's really good information. So really, for the first month straight after surgery, it's just following the instructions for the antibiotic ointment, which I believe can do like cell regrowth. Yeah, obviously on the incision areas.
Yeah, on the incision area.
Keeping the face nice and moisturized.
And also sunscreen.
Definitely sunscreen, especially in Australia. Nice big hat. What about when they want to restart fillers and Botox?
It really depends on which procedure they do.
Okay.
Like some procedure like facelift, maybe the surgeon sometimes asks you to do Botox to help restore the result. For example, after forehead lift, some surgeon asked me to put some Botox on the patient to help the muscle rest after.
That's so interesting.
Yeah.
Oh, of course, that makes total sense. Now you've just said it. So if they've kind of pulled the forehead up and the muscles are strong, they don't want to pull it down.
Yeah,
so the Botox will relax the muscles to let it heal properly.
That's right, because muscle movement sometimes also affect the scar to heal.
Oh yeah.
So Botox can help to reduce the muscle movement and also to reduce the strength of the scar. Yeah, so it can smoothen the scar in the future.
Okay. What if somebody wanted to get lip filler whilst they were under general anaesthetic? Is that possible? Because it really hurts.
Yeah, that's right. It's actually possible, but it really depends which surgery procedure they do. If it's really near the lips, it's not recommended.
Yeah. I think we've talked about loads of really good things, you know, CO2, Botox fillers, threads, how to prepare in the lead up to surgery, how to look after your facelift, protect your investment post-surgery. Maybe if we can pivot away from the cosmetic conversation a little bit and talk about something a little bit more health related that's very common is skin cancer. So, you know, obviously you can tell by me, I'm very prone. I suffer all the time with basal cell carcinomas, and I think in Australia it's like 1 in 3 people have skin cancer. So they probably have cover from their own doctor, but if they wanted to maybe have a screening whilst they're on holiday, is that something that you could do?
Yes, of course.
Yeah.
And it's quite often to meet like Australian or New Zealand tourists come here to do the skin check.
Yeah.
Like general skin check to just screen or maybe diagnose and some removal of the skin cancer.
Yeah. And what would that be? Would that be like head to toe or just whatever area they've noticed?
Yeah, sometimes people come for specific spots they noticed or maybe they worry it changed. So for that case, I will check directly for that spot. But we can also do the general skin check. We have dermoscopy here to screen the skin cancer. And then if after dermoscopy I found something suspicious, we can do further examination, which is biopsy, and check the sample to the lab.
Okay.
Yeah.
How quick can they get the results?
Usually it takes 7 to 14 days. It really depends on the tissue. Depends on the processing.
Right, okay, so you take a biopsy, send it to the lab, wait for the results, and I guess whatever the outcome is they could get treatment by you, or you could maybe give them a letter to take back to their doctor.
Yeah, because we have like several fields to treat the skin cancer. In some condition, I can treat right away. If the spot is not cancer, we can do like electroculture or CO2 laser. Or if we need further examination, we will check by the biopsy. Sometimes I remove by excision, small surgery, or cosmetic result. I can also refer our patient to plastic surgeon. Or for the skin cancer, we have also oncologist here. So for the further treatment.
So there's a lot of choice then.
Yeah.
I heard you say CO2 just then. You can use CO2 on it?
Yeah.
What, just like burn it off?
Yeah, just like electroculture. The difference is
right, okay, it's a different
electricity. Yeah. The laser will use the light.
So it's electricity or light. Wow, it sounds very futuristic. Do you have the option to use, I forget the name of it now, but there's a cream that you can use?
Yeah, maybe in Australia or New Zealand it's easier to find cream. Usually people with actinic keratosis or like flat seborrheic keratosis, sometimes we prefer the cream, especially for the wide areas that we cannot do the aggressive treatment. But other than the cream, we also have like liquid nitrogen.
Is that like the ice?
Yeah.
I've had that done before. That's more comfortable than fire.
Than fire.
I've also had the cream before as well. and it's really harsh because it like you literally light up for like 2 weeks and then it takes a while to go down and it peels off. But I think it's better than having a scar, I guess. Yeah, okay. So if somebody who's watching this video and they would love to have a consultation with you to get an assessment, whether it's for CO2 laser, Botox fillers, or to check for skin cancer, if they wanted to have a chat with you before they arrive in Bali, is that possible?
Yes, of course.
Yeah, we can just like get them to message PCS. We can arrange the consultation and you can have a chat with them, because it might be good for them to plan their visit, you know, before they come and maybe have an idea of cost.
That's right.
But if not, then they can just message us and we can try and get them in to have an appointment with you.
Yeah, because sometimes I really need to explain to our patients about the downtime.
Oh, the downtime,
so they need to estimate how many days they need here in Bali.
Yeah. Dr. Theresia, it's been so lovely talking to you. Thank you for your time. Thank you for your wealth of information and education. And I really hope the viewers have, you know, really learned something about what they can do in terms of preparing for surgery or looking after their surgery or avoiding surgery. Like, there's so much choice out there. I hope that we get lots of inquiries for you, and thank you again.
Thank you so much.
Thank you.